I'll be presenting today's Radiopedia.org case in radiology, inferior vena cava web. Case courtesy is demonstrated here, and the case link is in the description below. Presentation: we have a 20-year-old female presenting with recurrent abdominal pain and distension. Taking a look at the CT of the abdomen and pelvis with contrast, here the portal venous phase, we see that there's a focal narrowing of the intrahepatic inferior vena cava with a linear filling defect. There's also hepatomegaly and heterogeneous enhancement of the liver parenchyma. Segment 5 is notably hypodense to the rest of the liver. There's also splenomegaly and ascites. This patient had abdominal pain, ascites, and hepatomegaly, a triad classically seen with Budd-Chiari syndrome, or hepatic venous outflow obstruction. Budd-Chiari syndrome has many etiologies, and this CT directly shows one of the uncommon causes, an inferior vena cava web. An IVC web can be congenital or more commonly a sequela of prior thrombosis. This patient underwent inferior vena cavography, which confirmed an IVC web, and angioplasty was performed thereafter. The liver parenchymal nodules, volume redistribution, and features of portal hypertension are typically seen with chronic Budd-Chiari syndrome. Although the hepatic nodules are likely regenerative, hepatocellular carcinoma remains a concern and cannot be reliably ruled out on a monophasic study. The ideal imaging evaluation of such a case must include liver protocol CT or MRI. Inferior vena cava webs are an uncommon condition characterized by obstruction of the hepatic segment of the inferior vena cava by a membrane or fibrous band. This is often associated with occlusion of one or more of the hepatic veins.